Scoot to your
You're
right.
listening to the PT Pinecast, where smart people in healthcare come to make noise. Here's your host, Jimmy McKay.
Thanks, voiceover guy. I'm not on the camera. All right, scooch to your right a little bit. We are live. We're making this up. Doesn't really matter. It's a podcast.
Yeah.
Lisa VanHoose to my right, Rebekah Griffith to her radio right, and we're live from Graham Sessions. And I'm not sure why I'm asking this a lot, but how many Graham Sessions is this for you?
I was trying to count. I know it's been more than 5.
Wow,
Yes,
that's a lot.
keep fixing my
3?
mic.
2?
This is my third.
Your third.
Oh.
This is my third as well. So why did you come the first time, and why do you keep coming back? We'll go with Lisa first.
So I came the first time because I heard through the grapevine that there were these like heated conversations happening. And I was like, I needed to be in the room where it was happening. And I keep coming back because it's one of my favorite places, because you can come in here, you can have that conversation, say those things, and be like, what do y'all think about that? And
and the ground rules are we can say anything that was said, but we won't have to attach it to anybody. So you can feel free to say anything in that room.
Yes.
And so the ideas should leave the room, but who said them doesn't have to leave the room. I won't say what you said, but you did not shy at all. Went right to the microphone 25 minutes ago, and you're like, I have something to say. And I'm like, I don't know. I leaned over to someone else and said, she's ready to talk. And I know there's a line, but she's ready to talk now. And that's
Lines
good.
are not for Lisa.
Lines are not for Lisa. Why do you come back, Rebekah?
The first time I came, I was invited to be on a panel to talk about access, which is obviously one of the things that's most important to me, is that our patients can't get to us when they need to. And then last time I came, I gave a what I believe speech. And what I believe is that physical therapists could change the world, but we won't.
Why?
Well, because we're waiting for permission.
And we already have it. So we have
Yes.
to do it.
Right.
Yeah.
and
This is
we're
the door.
scary.
We're scary or scared?
We are scared. Oh, we're scared
Of?
of. I think it's our own imposter syndrome.
We're so rule followery.
Mm-hmm.
Oh. And we're very employee mindset.
Like follow.
Yeah.
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 Technician, not doctor.
Yeah.
Ooh,
Look
yeah.
at that. Yeah.
So I'm back this year to listen.
Cool.
Mm-hmm.
But you'll say something when you have something to
She
say.
already
And
said
you should.
something.
Yeah, I'm not good at actually.
But I won't
just
say
sitting there.
I can't say that what you said. That's the rules.
Oh.
What are you excited to see discussed, and what are you upset that it's not on the menu?
I'm excited about the big, beautiful bill conversation.
Okay.
That whole conversation around professional designation. What I am a little sad that we're not talking about is still the lack of diversification of our workforce.
I feel like we talked about that a lot, like 5 years ago.
But now we're scared.
And then we stopped talking about that.
Yeah,
'Cause it's
there's
solved?
political powers.
Right. Because it's solved?
Mm.
Because it's solved, or we?
Mm.
Yeah.
Well, now we're redefining, marginalized groups as dominant groups now.
Yeah.
Oh,
That's interesting point of view. Yeah. What are you excited and upset that's not on the docket?
I was excited to hear the primary care conversation this morning, because I think that's an area of practice that I'm in. But I'm also interested in the one about generational differences,
Mhm.
because I hear a lot of clinic owners and business owners complain to me and say, well, nobody wants to work anymore, or I can't get that generation to XYZ. And I also have teenagers, and we're like 6, 7 and all that. And I feel like we have to be able to communicate with the people that came behind us, because now we're just turning into our parents. So I'm excited.
We're
for that piece of
saying the things that
conversation.
we were pissed at our parents, these
100%.
kids today. I'm like,
Mhm.
now it's coming out of your mouth.
Yep.
So pause before you say that. So let's talk about those two that you just. So primary care, there was, and correct me if I'm wrong, I'll just structure it. There was a policy win in Utah. That's what sort of started. Hey, now we're primary care. And what does that mean? And what does it change? And all those things are for smarter policy people to talk about. I come in and I go, because I can say what I said. You can say what you said, but you can't say what someone else said. I said, this is awesome. And then I think I made everybody in this room, we're on the 7th floor of APTA Avengers Tower here in Alexandria, we're overlooking Washington. I made everybody look outside the window. I was like, look out the window, look at the window, look. And people weren't doing it. I was like, look outside the window. None of those people understand what the hell primary care physical therapy is. It's as confusing as, when do I go to the urgent care?
And
Or-
how many words was the definition?
83. Do you think I counted, or did I take a picture of the definition in AI and make it count for me? Of course,
Yeah.
because I'm not an idiot. But that's the point. And I will give credit.
People
This
just
is not
don't
me.
want to work hard
This
these
is
days. You
people
should have
wanna
counted it yourself.
Smarter, not harder. And I know that's an internal definition for us, and this is not to knock. I don't think anybody here is really to knock a person, but
No.
we're to push and pressure ideas and say, this is cool. And I think my last question or my last statement, which by the way is the best way to look smart, is just ask questions at a big conference like this, never answer them.
Oh, you
Just
taught
drop
a whole
them like
masterclass
last
in like
night
less
over
than
beers.
2 minutes.
My last question, or my last statement, which sounded like a question, was, this will fail if you fail to message this right. And I know I'm coming from a lens of marketing and communications, whatever it is, because it's my life, but I'm like, I see what you're doing. This is great. But if the people outside the 7th floor window here don't understand it quickly, clearly, concisely, consistently, we'll lose here. And we will be confused how we lost.
Yeah.
And I will point right back to that moment.
I actually disagree with you.
Oh, hit me.
I don't think that it's on the people outside to understand it. I think it's on every physical therapist to own it. And
then,
once they start practicing that way, that just becomes the standard of care. And so when people come to a physical therapist, that's just the care that they expect. So I think until every physical therapist starts leveling up and then providing that level of care, that level of expertise, it doesn't matter what the people out there think. Like marketing it and bringing patients in, we don't need to do that. We need to take the patients we have and own them.
Love it.
And raise those people up. And then, like you heard, there are people like, can you see this patient? Can you get this person in? Like, I've sent my physical therapist tons of patients because he does have a primary care mindset. And I know those patients will be taken care of, not treated.
Mm-hmm. Show, don't tell.
Mm-hmm.
That's what I should have said. That was my mic drop moment. Show the people outside this. Show the people directly outside this building, which are our colleagues. Show them how to communicate this, and then to be able to show, not just tell the public.
You have to be a primary care provider before you
I think
start
that's the thing.
doing
There you go.
marketing.
And
it.
now you don't have to market anything. You are
Mm-mm.
acting as if. Act as if. Maybe primary care. Maybe that's the rollout.
But maybe not act.
We got to
Be
bring it
as
back.
if. Okay. Well, I meant like act as if. Yeah, I know. But act as if. The first time I ever scored a goal in like high school hockey, like I celebrated like I just won the Stanley Cup. And my coach was like, hey, great work. Pretend like you've been there before.
Because I think part of our issue right now is we have a lot of PTs that are acting,
Okay.
right? Where we've got this list of things related to contemporary practice that you are fully aware that you need to upskill, but you're not doing that. And so I'm just going to put it out there. This is Lisa VanHoose. I'm saying this as an individual. You are providing subpar care.
Mm.
And so if that's what you're willing to do, then you can't complain about subpar payment.
Ooh.
So I'm like, level up, and then we can talk about having some improvements in payment.
Tony Maritato, my live stream co-host, has said and pointed out something similar, which is, do you honestly believe that half of the profession is better than what we're being paid? Because Medicare is just one example, is saying you are worth this much money per hour. And people get mad. I'm like, who's getting mad? Do you think that more than half the profession is better than that? If the answer is yes, then we deserve more. Or do we have to raise the floor of our care overall?
And truly, like, if you were being paid more for that, for what you were doing, where's the incentive to do better too? I think that's a piece of it also.
Chicken, egg, chicken.
Yeah. Because like right now, the big conversation is groceries, right? That's the big political conversation. I love Frosted Flakes.
Big fan.
Right.
Mm.
But it's got to be Kellogg's.
Mm-hmm.
But I'm going to be mad if I go pay a Kellogg's price and I'm getting some off.
Correct.
Oh, yeah. Yep.
I don't want that.
Agreed.
I don't want that. And so I think part of what we see in social media right now is patients and clients and caregivers are talking about, I went to a PT, I was expecting this, but I got something underneath that.
Mm-hmm.
Now, there are those PTs out where we're going to shout you out that are providing amazing care.
Mm-hmm.
But I'm not comfortable saying it's 50% of us right now because we're doing just enough for whatever reason. And that's where I feel like we need to follow some Mel Robbins, right? Let you move on. If this isn't what you want to do, if you don't want to upskill to where we're trying to be as a profession, move on. There's all different types of things you can do in the world.
Agreed.
You don't have to be
you
a
can
PT.
leave the house.
Spicy takes before noon at Graham Sessions, Lisa VanHoose. I don't even think that's spicy.
And
It's not even that
okay
spicy.
to change.
Yeah.
It is totally okay to change. I'm not going to call you a bad PT. I'm not going to say you're a bad human. You just decided that the profession is going this way. I don't want to do that.
Yeah. But then follow through on that. Don't stick around.
And then complain.
Right. Well,
or provide subpar care.
I will point that out as well. Being mad about a thing you're not doing feels a little bit defeated or not productive. So I just play the world's smallest violin for people who do that.
And life is short.
Yeah.
So don't do things you don't want to do.
Here for a good time, not a long time.
Yeah.
I had a conversation with somebody the other day that PTs like we're just in a burning building, and you know that you've got that meme where you've got the dog sitting in the burning
Mhm.
building. It's fine, it's all fine. And are you going to be that dog and just sit there while the burning building consumes you? You could exit the building. You could help put out the fire. But if you continue to sit there in the burning building and say, why don't the fire department come and put out this fire? Or I didn't start this fire. I'm getting burned and I didn't start this fire. Okay, so exit the building or get a fire extinguisher, but we need you to take a role here other than somebody that has to be rescued.
Yeah, I think I said this yesterday. The worst thing to do in a panic situation, my dad taught me, was panic. The second worst thing to do in panic situation is nothing.
Yeah.
Nothing. If you think it's that bad, don't panic, but do something productive. Leave whatever system you're in. And I'm talking about physically where you work or practice, or how you're doing that. Change you have other levers to pull other than leave completely, but it's also okay if you want to leave completely. The door, push, pull, it goes either way.
We all have power, right? So we've got power to change things within that building. I think people often forget that the profession is made up of people.
Mm-hmm.
So when you're talking about the profession sucks, you're actually self-loathing because you're saying you suck because you're part of us, right? And you also always have the power to leave. So I'm like, recognize your power and then decide on how you're going to use it.
Agreed. All right. We're trying to keep these short, under 15 minutes, all live from Graham Sessions. But we always do the parting shot.
This is the parting shot. One last mic drop moment. No pressure. Just your legacy on the line.
Sounds like scary when you say your legacy on the line. But parting shot, just one concept, one mic drop moment, just one thing you want to leave with the audience. What do you got?
You got to be about it, not just talk about it.
Crochet that on a pillow. Got to be about it. Don't just talk about it. Good luck following that.
I know that was a good one.
You have you have sayings.
I'm going to sit with the fact that individualism is a fallacy, right? So this concept that just you are going to make some difference or only thing that matters is you is a joke. It's all about the collective us.
All right. Well, we're going to have s'mores later because we're at Graham Sessions here at APTA headquarters in Alexandria, Virginia. Lisa VanHoose, Rebekah Griffith. Thanks for talking live.
That's it for this one, but we're just getting warmed up. Smash follow, send it to a friend, or crank up the next episode. Want to go deeper? Hit us at ptpintcast.com or find us on YouTube and socials at ptpintcast. And legally, none of this was advice. It's for entertainment purposes only. See, Keith, we read the script. Happy now?